Hi again, it's Dr. Kari with your weekend wellness tip. This week I actually wanted to talk about jaws. And the reason that I wanted to bring it up is because I got a terrible headache yesterday and I couldn't figure out why, because I do not get headaches very often. I treat them every day, but I don't get them myself every day. And then I realized that when I used to get headaches a long time ago, it was because my jaw hurt. And I couldn't figure out why my jaw hurt yesterday. And then I realized I had a mask on all day long yesterday. And this is not a post of pro-mask or anti-mask. So by the way, if you put a comment below this video that I'm anti-mask or I'm pro-mask, I will delete your comment. No hard feelings, but I'm gonna delete it because it's the internet and I can do that. But anyways, I was wearing this and I realized something I did when I wear masks, because I'm not used to wearing a mask like most medical professionals in the hospitals do all day long, right? I do this. So imagine this is here, but my mouth is slightly open all day long. I treated for about 12 hours yesterday. And so I was like, why does my jaw hurt? It's because my mouth is not used to doing this all day long. So anyways, I have to wear these according to the Illinois state guidelines right now, and I'm happy to do so to protect my patients and myself. And but in the meantime, I cannot have a headache every single day because of this. And I know it's not a tooth issue because I just visited my lovely dentist in the neighborhood, NK Dental, by the way, and she checked my teeth, and they are just as good as they always are, as well as, you know, all the nearby areas in my mouth. So I know it's because I'm mechanically holding my mouth open differently. So I wanted to get on here today to give you guys a few exercises and stretches, because I know I can't be the only one that's not used to this new way, and I don't want you guys to ignore this and then all of a sudden you do have jaw issues that are requiring you to come in years from now to myself, as well as your dentist that co-treats a lot of TMJ with me. And so I wanted to give you guys just a couple of exercises to deal with this. So we're gonna go with 3 tips today. And first one is just massage the muscles, okay? So what I want you guys to do is, if you come just forward of your ears, like kind of right past where the angle of your jaw is. So if that kind of makes sense right there. And so I always first kind of like to find the area. Now I professionally know where it's at pretty quickly, but for you guys, take your index fingers, because those have a lot of receptors in there so that you can find and understand the appreciation really quickly of, ooh, that's tender. I can find that really, really quickly. So if I start on my right one, I find, because it was my left side, right side when I'm looking at this video, that yesterday it was the left side of my jaw that was causing me problems, and then shooting a headache that was going into the back of my left eye. So anyways, so I find that really, really tender spot, and mind you, I've worked on this a lot since yesterday evening, and it's about 2:30 here today, and right now I find that spot right there. So what I'm gonna do is I'm either gonna take the pad of my thumb or my knuckle of my first finger, knuckle of my thumb, and so that I can really dig in. Sometimes I hold the spot. It is super tender. It shoots pain right here for me right now. If the knuckle's too hard, go back to the flat part of your thumb. That's gonna really help you. And if you really just dig into those muscles, anywhere from about 30 seconds to a minute on each side, you can do that multiple times a day as well. And so I also give this to all of my TMJ or jaw pain patients, and every single day, and they find that when they're consistent with the treatment, when I do my muscle work, when I am adjusting the jaw, that it helps them with pain relief for longer periods of time. So that's tip number 1. Try to give yourself a 30-second to a minute massage. You want to dig in there pretty hard, but of course within pain reason. So if 10 out of 10 means you need to go to the hospital, 0 out of 10 means no pain whatsoever, get yourself into somewhat uncomfortable of that 4 to 6 range on the pain scale, because as soon as you take your thumb away, guess what? The pain's gonna go away. Okay, so also because a lot of us are probably holding our mouths at different angles, right? That's gonna change the length of the muscles. So our masseter on the outside, our pterygoids out on the inside, which are our main jaw muscles, that if you Google jaw muscles, those are gonna be your top ones that are gonna come up. And so anyways, I want you to just practice opening your mouth all the way. And that sounds like a silly statement, but I'm amazed when I do posture exams in front of the mirror. So I put a patient in front of a mirror and then I say, look at yourself, and I'm standing behind them and they're like this. And they're like, I've never noticed that my right shoulder is higher. Okay, well, let's do that with our jaw as well. So what I want you to do is just open as wide as you can and then close and then open and then close. I'm doing it kind of quickly so that I can talk in between, but I want you guys to really slow it down. I know I look ridiculous on this video right now, but if I just slowly open, it decently opens, but I know this side's a little tight today. Some of you that have chronic jaw issues or are noticing more jaw issues right now may even see this. Just to open your mouth all the way. And just think, you need to be able to open your mouth to eat, because that's how we get nutrition into our body. Because if you can't eat, well, then that's not good. So we got to make sure our jaw and our teeth, as well as all the muscles around it, keep working really, really well so that we can continue to live every single day. Okay, so excuse me. That's tip number 2, is just open and close the mouth. Tip number 3 is just another movement of the jaw. By the way, I could go all day long on giving you guys jaw exercises, so maybe I'll make another video sometime soon with that as well. But what I want you guys to do is we're gonna translate the jaw side to side. That is not a normal motion, so we're not gonna do it as much, but it's just to, if there's any adhesions within the 2 jaw joints that are kind of, think of them like this, that there's like a little, you're going over and under, kind of like that, right? So we wanna translate the jaw to the right and then to the left, so. Right, so then we're just moving our mandible, which is our jaw, from side to side. I know I look ridiculous, it's so much fun. You may even hear some crickling, crackling, all those types of things. But if you just move it side to side, a set of 10, set of 12 per day, you're just getting those motions or the muscles to move, because some of us are changing kind of the length of the muscles by, if you're like me, imagine with my mask on, that I'm just slowly holding my mouth open behind my mask. So for any patients that come in to see me, that's probably what I'm doing when I'm not talking to you. But if you guys have any other questions, or if you never knew that I could treat your jaw in this office, please bring it up on your next visit, or tell your dentist. I co-treat with so many local dentists around here, where I refer outpatients, because sometimes, you know, it may not be a musculoskeletal problem. It could be a tooth problem. So we want to make sure that we work together and make sure we keep those pearly whites nice and working for you. All right, guys, have a great weekend.